Alright, if we talk about the muscles that we can see here, as we said before, this is the frontal belly of the occipitofrontalis. This is the orbicularis oculi with its orbital and vertebral part. This is the nasalis muscle. This is the levator labii superioris elig nasae. This deeper muscle is levator labii superioris. This is zygomaticus minor. This is zygomaticus major. This muscle is the buccinator, which is pierced by the parotid duct, the rhizorius masseter, and the levator depressor anguli oris. This is the depressor labii inferioris, the mentalis, and the circular fibers of the orbicularis oris. If you look at the other muscles, these are the superior interior and posterior auricular muscles. This is the auricle or the pinna. This is the occipital belly of the occipitofrontalis. This here is the sternocleidomastoid with its sternal end and the clavicular end. After that, we have the muscles that are splenius capitis, levator scapulae. After that, the scalenus posterior, middle, and anterior. This is the trapezius muscle. If you look at the floor of the mouth, we can see the anterior belly of the digastric muscle and the mentalis muscle. Going from the hyoid backwards, the anterior muscle is stylohyoid, and the posterior muscle is the posterior belly of the digastric muscle. Anterior to the hyoid and thyroid, this is the thyroid cartilage, this is the hyoid bone, between them is the thyrohyoid membrane. This is the stylohyoid muscle. This is the sternohyoid muscle. This is the omohyoid, its superior belly, and this is the thyrohyoid muscle. Alright, if we talk about the arteries and nerves, or other structures, this is the parotid with its duct, which is piercing the buccinator muscle. This is the external carotid artery and its branch, the facial artery, which has a sinuous course, and it gives off the inferior alveolar and the inferior labial and the superior labial branch, the angular branch, which ends at the medial part of the eye. The vein, this is the facial vein, which joins the anterior branch of the retromandibular vein to form the anterior jugular vein. Here there is some discrepancy because the anterior jugular vein is here, so the branching is coming towards the anterior side. This is the external jugular vein, which is formed by the posterior branch of the retromandibular and the posterior auricular vein, which form the external jugular vein, and it runs over the sternocleidomastoid. If we look at the internal structures, what we can see is that we have this frontal sinus, which is present between the two tables of the frontal bone. This is the sphenoid sinus, which is present in the sphenoid bone and the sala turcica housing the hypophysis cerebri. This is the nasal part, so this is the superior concha, superior meatus, middle concha, middle meatus, inferior concha, inferior meatus underneath it. This is the vestibule of the nose. Coming towards the nasopharynx, we have the opening of the pharyngotympanic tube, which is a J-shaped elevation, which is called the tubal elevation. Behind the tubal elevation, this recess is called the pharyngeal recess. This is the pharyngeal tonsils. This is the upper lip and lower lip formed by the upper and lower fibers of the orbicularis oris muscle. This is the hard palate, the maxillary teeth, mandibular teeth. This is mandible. This is the soft palate with the uvula hanging downwards. In the tongue, what we can see is that there are some longitudinal muscles. If we go from the floor, this is the mylohyoid, which we saw on the floor here as well. Mylohyoid, geniohyoid, from the inferior genial tubercle towards the hyoid, and then the genioglossus muscle. This is the transverse groove of the tongue, which separates the anterior and the posterior parts. Vertical part is the root of the tongue. In the oropharynx, we have the palatoglossal. There are two elevations. This is the palatoglossal arch, and this is the palatopharyngeal arch, which are formed because of the elevations of the muscles that form it in the oropharynx. This is the palatine tonsils. So this is the part of the oropharynx. After that, we have this hyoid bone, the thyroid cartilage, the ligament between them, the thyrohyoid membrane. This is the epiglottis, the leaf-like structure, and epiglottis is joined to the hyoid with the hyoepiglottic ligament, and it is joined to the thyroid by thyroepiglottic ligament. So this is the laryngeal opening. We cannot see all the other ligaments here, but this is the cricoid cartilage. This is the thyroid cartilage. This is the as well the cricoid cartilage. This is the vestibular fold, the ventricle, the vocal fold. This is the infraglottic cavity and the laryngeal inlet. If we look at this part, what we can see is that this is the superior sagittal sinus. These are the brain structures, which are the rostrum, genu, body, and splenium of the corpus callosum, the septum pellucidum, fornix, choroid plexus. This is the interthalamic adhesion. So this is thalamus. This is hypothalamus. This is the optic chiasm. This is the pituitary gland. This is the pons. This is midbrain. This is the cerebral aqueduct going towards the fourth ventricle, the cerebellum with the arbor vitae. Now after that, this is the medulla and the spinal cord. So we can see the vertebrae. This is the first vertebra, which in the cross section we just see these small parts because it is just like a ring. So this is the first vertebra. This is the second vertebra with its odontoid process and its spine. Third, fourth, fifth, sixth, and seventh vertebra with the longest. This is the seventh vertebra with the longest spine.